So we know that manual therapy is impacted by a lot of different factors like nutrition, visceral problems, medications, and brain science and pain science that we just talked a little bit about.
Yep.
So would you like to talk a little bit about these factors and how they impact on manual therapy?
Yeah, that's where the course multimodal manual therapy comes in, because I think one of the main things we're finding is that, for example, nutrition has a huge effect on musculoskeletal health. And I've read some recent studies this year and last year. There's a syndrome called metabolic osteoarthritis, which means that the way that you're eating affects the health of your tissue. It's acknowledged that your eating patterns will, cause cardiovascular disease and liver dysfunction and gallbladder issues and stomach issues. Well, now it's being determined that the nutritional factors can cause osteoarthritis. And so we've got to start talking to patients about their nutritional health, because it's not only going to affect their triglycerides and their heart health, it's going to affect the integrity of their musculoskeletal tissue and their joints. And I'm sure over the years, it's going to be found out that it affects not just the cartilage, which is a chondrocyte. It's going to affect the fibroblasts. It's going to affect the ligaments and the disc and the muscle tendon and all that. So I think nutrition is probably one of the biggest things. And in terms of visceral health, I know that I've treated a lot of patients over the years that for a long time I was seeing mid-thoracic problems that looked exactly like facet irritations, and they wouldn't respond to therapy. They would, but temporary, and it would come back before I finally understood that the gallbladder was referring to the thoracic spine. And so I had to ask about digestive health, and everything in the center of your body, from your gallbladder, your liver, your lungs, your heart, and your esophagus, can all refer back to the thoracic spine. So you have to ask patients about their visceral health. And it's not that we're going to make any medical determinations, but it impacts a percentage of their symptoms, a percentage of their subjective complaints of pain. So we should be able to talk to patients and ask them about all these other aspects. And if needed, you just say, well, I think you probably need to see your physician, because I don't have enough comparable signs to get you better. The problem in your back is probably coming from somewhere else.